This is my pretty much build a lecture for exam 10. The assignment was to cover three diseases of the skin or eyes. The first one that I chose to research was blepharitis. What is blepharitis, you may ask? It is inflammation of the eyelid. It occurs due to infection at the base of the eyelashes, where the tiny oil glands at the base of the eyelashes become clogged. That can happen by not washing your face, oils and stuff, like your face develops natural oils. It can clog it, makeup. It's very common and it affects more than 180 million people per year. It is treatable by medical professionals and it can last for several months or years. What causes blepharitis? The clogging of oil glands in the eyelids, which causes the inflammation, dandruff of the scalp or eyebrows, bacterial infection, mites in the eyebrows and eyelashes, which are little bugs, redness of the face, and if you're allergic to certain eye medications, I apologize. That can cause it. Contacts lens solutions, sleeping in your contacts, wearing your contacts for too long, reusing your contacts, like eye makeup, paint, like if you paint your face, anything like that can cause it. What are the symptoms of blepharitis? Watering of the eyes, eye redness, if your eyes start to burn or sting, if they get itchy, if your skin starts to flake around your eyes, if your eyelashes are like crusty when you first wake up, or you get really bad crusting around your eyes, red swollen eyelids, more frequent blinking, sensitivity to light, abnormal direction of growth of your eyelashes, loss of eyelashes, and infection of the cornea. Treatments. Most of the time, it resolves on its own with self-care, like washing your face, keeping your face clean. But if it doesn't, topical medications can be prescribed and it can help control the infection and the swelling and inflammation. Azithromycin, erythromycin, and tetracycline. Um, it can be prescribed to also relieve the symptoms like pain, discomfort, infection, and inflammation. And those antibiotics are either available in ointment, eye drops, or oral medications. This is a photo. So you can see that the eyelid is swollen and eyelashes you can see like where they're poking out along the part of the eyelid. Um, it just causes a lot of swelling and redness. Dacryocytosis, if I'm pronouncing that correctly, is the next topic that I chose to cover. What is dacryocytosis? It is known as an infection of the lacrimal sac. It occurs due to a blockage in the nasolacrimal duct, which prevents tears from draining properly, and it leads to inflammation and infection. It can be acute or chronic. That lacrimal sac, it is part of the tear duct system located in the inner corner of the eye. And about six babies are born with it, and it occurs more commonly in females than it does in males because a female passageway is narrower than a man's. What causes it? Old age, if you're over the age of 40, trauma like broken bones or nose surgeries, medical conditions involving your immune system like sinusitis, unusual nasal structure, tumors, certain drugs or medications, and retain punctal plugs. What are the symptoms of dacryocystitis? Eye pain, swelling around the inner eye, redness or skin darkening, an abscess or sore with large discharge or pus in the inner corner of the eyelid, so about right here, fever, watery eyes, and excess tears. Treatments that can be used are oral antibiotics like cephalexin and ciprofloxacin. There are others also, and those are used for 7 to 10 days. You can use antibiotic eye drops or ointments for mild cases or small flare-ups. If you take a warm rag, like you wet it in with warm water, or you heat it or something and you apply it to that area several times a day, it can help with drainage and swelling and soreness and inflammation. Surgical probing of the tear duct to clear blockage. That's mostly used for infants, or the removal of all or parts of the lacrimal sac. This is a photo. Like I said, it's just like a big sac of pus infection that occurs right in the corner of your eye. The third disease that I chose to discuss is endophthalmitis. Once again, I apologize. I'm very bad with names. What is it? It is known as a really bad eye infection. It's characterized by inflammation of the intraocular fluids, which is usually caused by infection. It's not common, but it can cause blindness. It can threaten your sight mainly if it's not treated quickly. And it's rare, but there are over 3 million cases that occur each year. What causes it? Infection. Either bacteria or fungi gets inside of your eye whenever you have surgery. If you're getting an injection in your eye, or you have an injury to your eye, it can happen. Um, Retain native lens material after an operation or toxic agents. If you have gram-positive bacteria or gram-negative organisms that tend to be more virulent and have worse prognosis, organisms that travel through the bloodstream and get into the eye, and somehow UTIs, IV drug use, surgical procedures, and indwelling catheters can also cause it. The symptoms include eye redness, eye pain, loss of vision, photosensitivity, which is sensitivity to bright light, swollen eyelids, watery eyes, and white or yellow discharge coming from your eyes. Treatments that are used involve antibiotic or antifungal medications, corticosteroids, eye drops or injections, and a vitrectomy. It's a surgery, and that's in severe cases. And this is a photo. You can see that the eye is really red and gross. But that is all. Thank you.